been to a couple of meetings with President Clinton, and you get the feeling, I mean, you know him personally, sitting with him, that a lot of his, and this reminded me a lot of his humanitarian work that he's doing with his foundation is to sort of make up for the work, what he didn't do and what he did wrong as president. You really get the feeling he has sort of, you're making.
You know, I think that's part of it. I think he's.
You know, and but I get the feeling, you know, your humanitarian work and your extraordinary work to try to change the world is because you recognize how, despite your illness, how lucky or blessed you keep saying that. So I think you probably really feel that. And you know, I suppose if you have to have an illness in America, it's, as I wrote on my blog today, it's better to have the financial abilities that you have, because in this country, this is a commodity. You know, healthcare that we buy and sell.
But I also don't want to have the misconception that if you have money, you're going to live.
No, of course not. Of course not. Well, that's true. But I mean, I would bet there are. You know, someone mentioned statistics, and there was a study from Harvard recently that the number of people who die every year simply because they don't have insurance. Well, in your situation, it's beyond not just having insurance.
Right.
You have insurance, but it's still an enormous financial expenditure.
In terms of aha moments, though, I'm listening to you tell your stories about Haiti. I wonder, though, if we're not actually kind of crippled in a sense in this country by having so much. In listening to people who have absolutely nothing, you know, when I think of Haiti, I think of a country that's been reduced down to civil society for more because of its own problems. And you go there and you find these incredible solutions to these problems that are taking place despite the fact of nothing. And so, you know, listening to you talk about that, I wonder if maybe we haven't looked enough in this country inside communities that have already been broken down because they don't have coverage, they don't have income, and they've been, you know, for a variety of other reasons, and that they actually have this incredible willpower and creative potential with just, you know, just a little bit of seed money or organization to solve some of these big problems that we have not been able to solve because we're in a kind of, you know, deer caught in the headlights where, you know, we think that we've got a great system, but in a sense we've lost our motivation to solve things because we aren't really feeling it as much as other people have.
We have time for one more aha moment.
I was going to say, if you try to cover everybody, people have the idea that the cost is prohibitive, unless they feel it themselves. And the government is trying to say, well, we're going to cover it by doing A, B, and C. And I think nobody believes them. I think it's part of the problem is the cost of it. And they don't realize that if nothing is done, it's going to cost them even more. And that message is not getting through. Maybe it's not being told correctly. Obama gets up and he says, and you say, the healthcare system is a catastrophe. People don't understand what is the catastrophe that we're talking about. It's wrong, we need to fix it, but these specific elements, one of which wasn't mentioned earlier, was the drug companies, not the drug companies, but the healthcare companies, and overcharging and the mischarging. I've just gone through this with diabetes supplies for my wife, and they just keep sending them whether we ask for them or not. I finally had to call up and say, hey, stop. Oh, well, okay, you need to send us a letter. I needed to get permission to send the supplies back. I took a picture of all the supplies. I sent a letter and I asked them to please send me an accounting and send me a letter explaining to Medicare that you're returning the money. And I didn't hear from them. Goes back to mid-July. Well,
This is a great story.
I finally got on the phone 2 days ago. I found out the name of the company that owns Liberty was Medco. I called up the president's office. I got to the secretary, and I explained the situation. And because I called them and called them and called them, and they never responded. And I've had 6 calls in 2 days.
Because they wanna keep sending those supplies, because Medicare is paying
Oh, well,
for
it
it.
wasn't only supplies, but they owed me money back that they
Right.
had taken out of the credit card. Plus, they charged Medicare.
Right,
But the co-pay was what we paid, but
Right.
Medicare was paying the remainder.
right.
So we're just one family.
Right.
Could you imagine
Okay,
how many?
imagine how much